Two-tier healthcare is coming to Alberta. That's according to new reporting from the Globe and Mail. Draft legislation obtained by that publication says the province plans to soon allow its physicians to work in both the private and public sector, a first-of-its-kind parallel model in Canada. The legislation isn't near ready, but as Tim Brooke explains, it's already sparking heated debate.
Alberta will soon allow its physicians working in the public healthcare system to also offer services in the private markets. Right now, it's one or the other. Reporting from the Globe and Mail says the new system will soon be part of the Alberta Healthcare Insurance Act.
I can't speak to specifics of legislation before it gets into the House, but I am always looking for opportunities to make sure that Albertans have increased access to the supports and the resources that they need.
This professor of healthcare policy says it is clearly two-tiered medicine.
It's a major concern for publicly funded healthcare. This will cause wait lists to go up in the public system. The only people that will benefit are those who are fortunate enough to have the money to pay.
Critics worry doctors will make more money working fewer hours in the private system, eventually incentivizing them away from the public one.
Doctors will keep up their wait lists in the public system longer so that people are willing to move over to the private system.
Imagine you are at Canadian Tire getting ready for your winter tires and there is a huge lineup for the cashier. And the manager says, no problem, I'll open a second lane. So they open a second lane, creating two lineups, and there's only one cashier covering both lineups.
So will the Premier commit today to dissolve this legislature and cause an election on this issue?
Well, Mr. Speaker, no. But let me tell you what we will do. We are going to continue to create the very best environment for doctors and specialists to work here.
There are proponents of this system. Some believe the model can streamline care and help certain patients receive treatment in a timely manner, something that doesn't happen enough in Canada. But the idea has been floated and flopped before. Ralph Klein tried the third-way approach in 2006 before dropping it after intense public pushback.
Tim joins us now. Tim, Ottawa will be watching this likely legislation closely.
Well, yes, Tara, because in theory, the federal government could withhold health funding from any of the provinces if it felt like they were trying to skirt around the Canada Health Act. Now, we don't yet know the specifics of what this bill will look like by the time it's tabled, but we still asked Ottawa today if that could be in the cards here in Alberta. The federal health ministry would only tell us that it's having conversations with the Danielle Smith government about this potential piece of legislation and didn't want to comment further, Tara, until it had a few more specifics.
Thank you, Tim.